the most important thing is really the vaccine. The only way that any of this will ever end is honestly is if we all, get the vaccine, and we'll talk about, what that means. But that really should be our push. Unfortunately, we don't have unlimited resources. So our goal, especially over the next couple of weeks and months, is to shift, not all, but definitely a large portion or some of those resources into vaccines and making sure that the people can receive it.
Hello, I'd like to welcome you to another episode of our Above the Bar interviews. Today, we are very fortunate to have Dr. Williams from Mariposa, as well as Dr. Lunderville from our district. And then soon, we'll be having Dr. Pereira, who will be coming in as well. Today is kind of a different episode for us. It's an episode where we're, wanting to thank Dr. Williams and Dr. Pereira for all their assistance that they've given us through this COVID-19 experience and pandemic. We've been very fortunate to have them as a partner in a lot of different ways. And so we're also going to give an update and kind of a little bit of education on the vaccine, because I know there's a lot of questions from our community about that. So first, Dr. Williams, why don't you just introduce yourself and tell us a little bit about yourself as we head into this conversation.
Thank you so much for having me. My name is Philip Williams. I'm a pediatrician here at Mariposa Clinic. I have lived in this area for going on 11 years now. I'm actually from Indiana originally. Did schooling kind of all over. Went to college in New Orleans and then med school in Indiana. Then I did my pediatrics training in Chicago, and actually came to Nogales straight out of residency, so straight from Chicago. So from the freezing cold to the beautiful Southwest, and I absolutely love it here.
Well, we're very fortunate to have you. Like I said, we've been very fortunate to have you as a partner with our district. And we've introduced a few things such as the Telemed, as well as doing a lot of testing, and now heading into the vaccine. So as we're going through, I'm going to ask a few questions. So first, starting out with the Telemed. Why don't you explain a little bit about that Telemed program and how we've been able to partner with you?
Yeah, I think this is actually one of the more, probably, well, in my opinion, one of the most exciting programs that we're starting. It basically brings healthcare directly to the schools. So traditionally, in order to have an appointment with a physician or provider, you have to, take off work, you have to bring your kids out of school, you have to come to our clinic. And then, 6 hours later, then, maybe you can go back to school, or usually you miss a whole day. So with our Telemed program, we're basically taking what we do and putting it in the schools. So Rio Rico High School and also Nogales High School are our pilots, but we're quickly going to expand to all the different schools in the county, where you're going to have basically a telemedicine station at the nurse's office. So if you have someone who is not feeling well and they would go see their school nurse or the health aide, they will then decide kind of what happens. If they think that the visit does need a physician or provider, then they will simply contact us, and within a few minutes, you will be in contact with a physician. So it's one of our pediatricians. We will be located here at Mariposa, but we will be able to interact and basically do most of the health visit right there in the health office. We're also exploring digital stethoscopes and otoscopes. So what that is that I can, from Mariposa, I can listen to the heart, I can listen to the lungs, I can look in the ears, I can look in the throat remotely. In a lot of cases, you can say, hey, you may have an ear infection, but I can send a prescription to the pharmacy and you can go back to class. Your parents, they don't necessarily have to come in, even though, they can be on the call, or they can also be a part of the visit. So, more to come. We really want to get, we've already tested it at Rio Rico High School. We're super, super excited.
And we're very excited about that. I know that's been something that Dr. Lunderville has really been trying to bring to our district for a while, working with you. So do you have to have insurance, or is there some type of requirement that you have to have from a student or a staff perspective before they can use the Telemed?
It's a great question. So, the good thing is being a community health center, there are a lot of different options. In general, a telemedicine visit is billed very similar to a normal doctor's visit. But, being Mariposa, we have sliding fee scales. So we have all options for people that don't have insurance. You would simply contact the clinic. We have what's called a eligibility office, and they can go through all the different options. For people that have, for instance, access or Medicaid, the visit is completely funded. And then, there's also different options for private insurances. In some cases, there's a copay. In some cases, there's not.
Great, thank you. And a question, I know that's something that, might be a little bit further along in the process. I know that what Dr. Lunderville overseeing our JTED, which is our Joint Technical Education District, with our CNA program. Is that going to be something that we'll be able to look at in the future to be able to incorporate some of our students within that program?
Definitely. A lot of students, especially, CNA students, who really want clinical experience. So in the past, you have to go kind of wherever will accept you. You may have to go, Green Valley or even Tucson or other places. With this program, you basically can work directly with us. And our goal is to have you be able to stay right here in our county.
Great. And again, we're excited about, I know, like I said, Dr. Lunderville has been very, passionate about both of those programs and getting those opportunities for our students, as well as being able to provide that to our families within the district, because it is for families as well, correct? So if a family wants to, they can't get down to the clinic, they can come to a school site and do the telemed visit there as well.
Exactly. It's not only for students, it's also for faculty as well. So, any of your faculty or staff. And then, of course, in some cases, exactly, families as well. So it really is for everyone.
Great. So the next thing I want to kind of just talk about is the testing. We've been able to partner and have a lot of testing. I've been able to share at some of our state superintendent meetings that we've been able to partner, and they're like, how did that happen? Because a lot of areas have not been able to do the amount of testing and frequency that we've been able to do. And I know you've been working with Dr. Lindbergh on that. So will you tell us a little bit about the testing program that we've been able to utilize?
Yeah, of course. We realized pretty early on that, especially if you're going to hybrid learning, or especially if sports teams are practicing, it's really important to identify those people who are positive for the virus. So how do you do that? Obviously, testing is the best way. So we've been doing either weekly or biweekly testing at a lot of different sites at Rico High School, also at NHS in Patagonia. So kind of all over, in order to, one, identify those people that are positive, because, as you know, with COVID-19, a lot of people can be asymptomatic or have very, very, very mild symptoms. So we picked up a number of people that we were then able to isolate and then prevent them from infecting other people. So yeah, it's been a huge success. One of our director of operations, Janet Olivaria, has been really influential in making sure that we're able to test a high number of people.
And we've been able to do that with limited cost, or at least to our students and staff. How has that been possible?
Exactly. So, basically, with testing, if you have insurance, it is billed, but there is no actually out-of-pocket cost. So insurances that require a copay, there actually is no copay. And then, of course, for patients that don't have insurance, we also, there is no actual upfront cost to the actual patient.
And so I know we're kind of moving towards, now that we're going to be heading into the vaccine testing, is that going to continue as far as the need for testing, or is the vaccine going to limit some of that testing?
So it's a great question. Testing is definitely important. Like I mentioned, you definitely want to identify those people who are positive. But the most important thing is really the vaccine. The only way that any of this will ever end is honestly is if we all, get the vaccine, and we'll talk about, what that means. But that really should be our push. Unfortunately, we don't have unlimited resources. So our goal, especially over the next couple of weeks and months, is to shift, not all, but definitely a large portion or some of those resources into vaccines, and making sure that the people can receive it.
So that kind of leads us into the vaccine, yeah, because I know that's the kind of probably the big question that a lot of our community has. I know Dr. Lunderville has been inundated with questions from our staff and parents. When are we going to get it? Who's getting it right now? What does it do? Do I have to get it? All of those different things. So I will, turn it over to Dr. Linderville to ask a couple of questions. As far as the vaccine goes, because again, she's been working more directly with it. So, Dr. Linderville, if you would mind asking some of the questions that have been asked of you to educate some of our community.
Sure. Thank you for joining us, Dr. Williams. I think the first question that most people are asking is when. And so if you want to explain a little bit about the process and how the Department of Health Services differentiated the groups.
Exactly. Yeah, great question. One, I just want to say I put on my mask. Our wonderful medical director, Dr. Eladio Pereira, he just joined us. It's a really, really good question. So basically, we know that you can't vaccinate everyone at the same time because obviously there are a limited number of vaccines. So that's why the Department of Health, the CDC, they came up with different vaccine groups. The first group is what's called the 1A group. The 1A group are physicians and then nurses and basically frontline healthcare workers. So that includes, EMTs, paramedics. For that 1A group in our county, we have roughly 1,000 people. And luckily, over the last month, we've been able to almost complete that entire 1A group. The next stage is what's called the 1B group. So 1B group includes, it does actually include teachers. It also includes critical infrastructure workers like produce workers. It includes people over the age of 75. And it also includes public safety or law enforcement. So here we have recently started actually on Friday with the 1B group, specifically with our law enforcement and public health public safety. So that includes CBP, Nogales Police Department, Border Patrol, Sheriff, Highway Patrol. We've started with that group as well as people over the age of 75. As soon as we finish that group, then we will move on to other 1B group, including people in the schools and including produce and other critical infrastructure workers. The big question is, when will we get to the schools? When will we get to the other people? A lot of it is dependent on the allotment of vaccines that we receive. We're currently promised to receive roughly 200 vaccines per week. At a rate of 200 vaccines per week, it'll take, weeks to months in order to finish, just law enforcement or to finish, just people over the age of 75. So we're working really closely with the county. And also we just recently met with Representative Danny Hernandez and also State Senator D'Alessandro in order to advocate for more vaccines. If we're able to dramatically increase that number, then our timeline can really increase. So, the quick answer is, when will everyone in the 1B group receive the vaccine? All I can say is soon. A lot of it is dependent again on how many vaccines we think we receive, but we hope within the next few weeks. After that group, then comes a 1C group. 1C includes people over the age of 65 and older, and also people with chronic health issues. And then after that group, we would go on to the general population. So, at our current rate, we'd probably say, honestly, I'm sure you've heard this in the media, our goal is to have, most people in our county vaccinated by the spring. And, I really think that, especially working with the health department, that we will be able to achieve that.
Okay, great. Do you want to explain a little bit about the vaccine? What is it? How many shots do you have to receive? What's the expected wait time after? What are some side effects? Just some basic information about the vaccine.
Of course. So there are basically two major vaccine manufacturers that we are currently using. It's either Moderna is one company or Pfizer is the second company. Both vaccines are very, very similar. They are what are called mRNA vaccines. What does that mean? So mRNA is basically it codes for, or basically is the blueprint for the spike of the COVID-19 virus. So I'm sure you've seen, a model all over the media of what the virus looks like. You have the circle, you have these little spiky things coming out of it. So basically what the vaccine does is that it codes for those spikes. So basically, I don't want to get too technical, but what it does is that it basically tricks the body into producing what are called antibodies. So you get the vaccine, your body then recognizes that as foreign, and it makes what are called antibodies, which are basically your army to help fight infection. So what happens is that if you do become infected with the virus, the body says, "Hey, I've already seen this virus. I know what it looks like. I can now start cranking out these antibodies. I can now start cranking out these things to help fight infection." So the studies have shown that people that have gotten the vaccine, they either have very, very, very mild disease, or they don't have disease. And the studies have shown it is incredibly, incredibly effective. It's up to 95% effective in preventing COVID-19. As you know, COVID is really ravaging our community. There's roughly 4,000 deaths just in the U.S. per day. And so, with a 95% success rate, that is absolutely huge. A common question that we get are, what are the side effects of the vaccine? Honestly, so far the data looks really, really good. There have been, very few, if no, serious side effects from the vaccine, and we've already given millions of vaccines already here in the U.S. and even more in the United Kingdom. So there's very, very, very few. The first couple of weeks of the vaccine, you may have heard some reports of something called anaphylaxis. Anaphylaxis is basically a severe allergic reaction to the vaccine. Those reports have been, extremely rare. Initially there was, 6 out of, 600,000 people that got it. So that's like they got the anaphylaxis. So that's basically a 0.00002% chance of having something, having a serious reaction. It is fairly common that you can have what's called a local reaction. So local reaction could be, a little pain at the injection site. It could be swelling. It could be a little tenderness. Up to roughly 10% of people may have fever. But I always say that could be a good sign, because basically that is your body building an immune response. So, if you have those local reactions, it's basically your body's way of saying that, hey, I am actually building an immune response, or I'm building antibodies or things to help fight the virus. But all of those, they go away typically within 48 hours. So within 2 days, all of those mild symptoms, they are gone.
Okay, great. And Dr. Williams, who can get the vaccine?
So currently, the Moderna vaccine is approved for people 18 and above, and Pfizer is approved for people 16 and above. They're doing a lot of research, though, recently on kids. They've started 12 and above, and then in other countries, they've actually started doing vaccine research in kids 10 and above. The CDC has said that, we hope to probably by late summer, early fall, start vaccinating kids. So start vaccinating that 12 and under age group. So here currently in our county, as of today, we're only currently doing 18 and above, because we currently only have the Moderna vaccine. Although we likely in the near future we'll have both.
Okay, and the Moderna vaccine, is that just a one-time shot, or are there two?
So both are actually 2 injections. So the Moderna vaccine, you get the initial injection, and then you get a second one roughly 28 days after. There is a little bit of time kind of before and after that you can receive it, but let's just say 28 days. The Pfizer vaccine is 21 days. So in both, again, have some leeway, a few days before and also after.
And Dr. Williams, if there was for any reason that we didn't have the 21 days later, didn't have that second shot available, what happens? Because I know that's a question that a lot of staff has asked, especially because we've been receiving such limited number of vaccines in our community, that second shot, is it going to really be available when they need it?
It's a great question. So the good news is that the state and the federal government are basically stockpiling that second dose of vaccines, meaning that they're in a separate allocation. So for instance, roughly 28 days ago, we gave that first dose of vaccines. Actually, next Tuesday is when that first group of people will start to receive the second dose. we will receive a separate allotment of vaccines for the second shot. So that is a separate allotment.
Okay. What about individuals who may have health conditions or, concerns with other treatments that they're having?
Very good question. So, and the good news is that, again, the vaccine seems to be very, very, very well tolerated. The only real major contraindication is if you have a history of anaphylaxis or severe allergic reaction to the specific components of the vaccine. So, for instance, if you have an allergy, to peanuts or to other stuff, or you receive allergy shots, you still can get the vaccine. Even if you are immunocompromised, you also can receive the shot. So there's very, very, very few reasons why someone would not qualify for the vaccine. If someone does have very complex health issues, we always say, obviously, talk to your doctor or physician. But in almost all cases, people still can receive.
Okay. What about those who may be expecting a child?
It's a great question. So it's kind of well, it's not a trick. It is sort of a trick question. In general, what we recommend is that for pregnant moms or even for breastfeeding moms, that they first consult with their physician to talk about, if they can receive the vaccine or not. Our director of obstetrics here at Mariposa, in most cases, does recommend it. And a lot of OBGYNs around the country also recommend it. The reason is that one, the vaccine has not been readily studied in pregnant women, which is why we're always a little bit cautious. But, when you look at the immunology and you look at the science behind the vaccine, it's very similar to other vaccines that we've used that you actually can use in pregnant women. So we think that the science says that, pregnant women should not have any severe reactions to it. But the main thing is that if you look at the risk of, getting COVID-19, the risk of spreading it to, your family, the risk of spreading it to your little newborn is very high. The potential risk of any side effects if you're pregnant is low.
Dr. Rose, a question. So the flu vaccine, we've had that question of, I haven't got my flu vaccine yet. Can I get both at the same time, or is there, concerns with getting the COVID-19 vaccine and then getting the flu vaccine? Is any issues with that question?
Right. Very good question. So typically, we recommend that you don't get vaccines or, for two weeks before and also 2 weeks after. So if you've had your flu vaccine, more than 2 weeks ago, you can still get the COVID-19 vaccine.
Okay. And then another question that has come up with the vaccine, now that we're talking about vaccinating the adults and not the students, and when we bring back students, are students still susceptible? Because the question is, well, now that I have the vaccine, do I still have to wear a mask? Those type of things. Questions that are the protocols going to change? So, and our comment has been, no, we believe that you need to follow, but of course we want to ask the medical professionals.
Exactly. Very good question. We still recommend that you do exactly the same thing that you're doing. You're still going to have to wear a mask. You are still going to have to social distance. You're still going to have to wash your hands. Even after you've gotten both doses of the vaccine, we still recommend that you do absolutely the same thing for a couple different reasons. The first reason is that, I said it's roughly 95% effective for the Moderna vaccine. Well, 95% is not 100%. So there still is, even though smaller, much smaller, there still is a chance that you can get the virus. The other thing, just like you mentioned, is that it's going to be a while before, not only kids, but also a while before the general population is vaccinated. Another big question is, we still don't know is, we know that if you get the vaccine, your risk of getting COVID-19 is very low, but we still don't know if you're still able to be a asymptomatic spreader of the virus. So it is still possible that you could still spread the virus, even though you personally after the vaccine will not get sick. I mentioned that there are 2 doses of the vaccine. After the first dose, 2 weeks after, you're roughly, let's say, 55% protected. After that second dose of the vaccine, after 2 weeks of getting it, you're roughly 95% protected, just as a FYI. The other big thing is that you really need a large number of people to receive the vaccine in order to have what's called herd immunity. Herd immunity is basically the percent of people that you need to have vaccinated, in order to protect those who are not vaccinated. The higher the percentage, the better. Dr. Fauci has said he thinks it's roughly around 85% of the total population who needs to be vaccinated. For other things like, measles, it's even higher. We think it's roughly 95% of the people who need to be vaccinated. So regardless, we're still going to need a high percent of people vaccinated, before we can really start to lessen all of the measures that we're already doing.
And another question is if I've had COVID-19 already, do I still need to get the vaccine?
Yes, for a couple different reasons. One is, we do know that after you've had COVID-19, the infection, your body does produce antibodies, and you do have some partial protection. The big question is, though, for how long? For most people, within 3 months of being infected, it's unlikely that you will get reinfected, but it's still possible, but it is less likely. But then after that, there have been cases of reinfection. So you definitely still need to get the vaccine, even if you have had COVID-19. We do recommend, though, that you complete your 10-day quarantine and also have improving symptoms before you are vaccinated.
Okay. And then the question is, how frequently will this be available? Will it be like the flu vaccine? Will it be a year from now? Will we have to go through the same process and have another vaccine a year from now? Or how long does the vaccine last?
That is a great question. And so far it is unknown. Basically what we're doing is that, places all over the world, they're doing research. So we're measuring the level of antibodies, and that can only be measured over time. So they're keeping an eye on that to see. But as of now, we don't know.
Okay. Dr. Lerville, any other questions that you can think of that we've been asked?
No, one question, and just our district's overall plan is to continue to work with Mariposa as well as the health department, so that those two entities are not inundated with calls about the vaccine. If you have questions about the vaccine, of course, you can always talk to your doctor if it's medical related. But if you have questions about scheduling or questions about when and how, our district is going to work with both of those entities to prioritize and schedule our employees and staff and students who may be eligible as well, depending upon their age, to go ahead and get their appointment to get vaccinated. So if you have questions, you can always reach out to your site administrator or any of the administrative staff in my office. I'll gladly answer any questions, but we are working on a schedule. If you call Mariposa directly right now, Dr. Williams, can you explain what the response would be? That more than likely would be asked to consult with their employer right now, or is there a process that we're letting people know about?
Yeah, no, it's a great question. So, currently, as I mentioned, we're only vaccinating law enforcement and then people over the age of 75. So for law enforcement, we recommend that the supervisors, that they contact us in almost every case. We have already contacted all the supervisors, but they should basically go through their supervisor in order to schedule an appointment. For people over the age of 75, we recommend that they contact the Santa Cruz County Health Department. They're actually scheduling those appointments. As we move on to the schools and as we move on to produce and other critical infrastructure, we'll be doing very similar. We are going to go through, the supervisors, we'll go through the districts in order to help schedule those. So basically, if they call the clinic now, asking for the vaccine, they'll basically be told that, one, they'll try to find out what group you're in, but basically they're going to say if you're law enforcement, we'll help to schedule. If you are over 75, they'll direct you to the county health department, and for all others, they will say that we will contact you as soon as we have vaccines for your specific group.
Okay, and if one other question, if I live in Pima County but I work in Santa Cruz County in our district, can I still receive a vaccine in Santa Cruz County?
You can. We are asking that you either live or work in our county. in order to receive it. And if I may, if I could even ask a question, a common question that I get, actually, even my mom, she was talking to me the other day. She's like, Phil, they developed this vaccine so quick. How can we really, it's way quicker than anything else. How can we know that it's safe? If you can, I just want to give kind of 5 minutes to kind of answer that question, because I know it's out there. Like, a lot of people are really, really skeptical. So it's kind of a long answer, but in order to understand how they were able to develop this vaccine so quick, you really have to look at the different stages of vaccine development. So the first stage of vaccine development is called the preclinical stage. So that's basically where it's called sequence the virus. So they try to figure out what the virus looks like. They also try to develop technology of how to distribute the vaccine. So in this case, we were able to sequence the virus very, very, very quickly, really within a matter of weeks. Also, and that's for a couple different reasons. One reason is that, literally all over the world, they pumped in, really billions and billions of dollars in order to help to sequence the virus and figure out, what exactly is it. Also, a lot of companies said, this is all we're going to focus on. We're going to kind of put everything else that we're working on kind of on the side. We're really going to focus on this. That, combined with, a ton of money and a ton of resources, means that you can get things done very, very quickly. The other thing that happens in that preclinical stage is that you try to develop the technology of how to give the vaccine. That can literally take years. We had a huge advantage with COVID-19. Ever since 2003, when they had the SARS epidemic, we started developing this mRNA technology. So we have, roughly 17, almost 20 years that led to, the technology in order to distribute the vaccine. So we already had a huge leg up. So normally that preclinical stage literally can take 1 to 2 years. They were able to complete it in basically 3 months. So within a few months, we were already done with that stage. That next stage of vaccine development is called the 1A and 1B stage. So that's where they actually start to try the vaccine, but in very, very, very small numbers. Typically they would test the vaccine in roughly 20 to maybe 80 people. In this case, they did those first 1A and 1B trials in roughly 1,000 people. Why? We needed a lot of data really, really quickly. When they moved on to the stage 3 trials, where they expanded to larger populations, typically they would initially start with maybe 1,000 people. In this case, they started with up to 60,000 people in some of those initial trials. So very, very quickly, we were able to get a ton of data. And again, all the data has been really, really reassuring. It says that, it is 95% effective with very, very, very few side effects. So, that's just a little snippet of, money combined with, large patient size combined with existing technology, which is why we were able to develop the vaccine so quickly. And if you look at the actual time that was spent doing research, that 7 months that they spent is actually very similar to other vaccines that we have created. They were able to cut out a lot of the kind of red tape, and also there was a lot of information sharing that typically does not happen. So that's the whole reason why, within 9 months later, we now have a very, very successful vaccine.
Well, I'm sure will be reassuring, to many of our community members, the safety of the vaccine. But I brings up another question that I get. Is a new strand, so what is the new strand? Because we keep, I know that's been in media as well as, a new strand that the vaccine may not be effective, or is there going to be some manipulation to the vaccine based on the previous data?
Yeah, it's a great question. So, one thing about viruses that we know, that viruses that they can definitely mutate. It happens commonly with viruses, even the influenza virus. The reason why you have to get a flu shot every year is that the virus, it does mutate. So we are able to account for that. It's called antigenic drift. The good news is that we think with the recent new strand that, first started, we think in the UK, that, now it's here in the US, we think that our current vaccine is still effective for that new strain. Common question that I get is, well, maybe I want to wait on the vaccine. I want to wait, let's wait 9 months. Well, no, like we want to really try to get as many people vaccinated as soon as possible for all these different reasons. The virus can mutate. Also, you really obviously want to protect yourself. We need a high number of people protected in order to get that protection for all of us as quickly as possible. So we say as soon as your group becomes available, as soon as we announce that it's there, please get it as soon as possible.
Great. Dr. Linderville, any other questions that you have?
No, I think that covers everything. I don't know if Dr. Williams has anything else he'd like to add, or if Dr. Pereira is available so we could introduce him.
Yeah, no, of course. I first just want to say, you guys have always been really at the forefront, especially in our county. If any time that there is a new and innovative and exciting program, you guys are always, super excited and always really gung ho. So, we really, really appreciate that. And we really appreciate our partnership. And, I just want to introduce, my boss and mentor, my friend, Dr. Eladio Pereira.
Dr. P, how are you?
Good. How are you?
Good. Thank you for joining us. And I know you're very busy. Both of you obviously very, very busy, and we appreciate your time. But at the beginning of this, I mentioned how fortunate we are to have Mariposa and both of you as our partners, and being able to do the things that we've been able to do, from Telemed to the testing, and now moving forward with the vaccine, and really being part of our district and part of our community. That's one of the reasons we wanted to do it as an interview, to say thank you as well, because we really truly appreciate the partnership that we've been able to develop. And we know that it's really for the benefit of our students and staff and our entire community to have that relationship. So we thank you for that. But I'll turn it over to you if you have any other comments that you would like to share.
No, thank you very much for those words. They mean a lot to us. I think I can speak for Dr. Williams. Our energy comes from working with all of you, our patients, to improve the lives of the community. That's what we hear. I say, it's to improve people's lives. It could be healthcare, it could be counseling, it could be just listening and all of that. So that's what we're here for. I can reassure you and the entire community that at the moment, there's no other activity other than routine patient care that is more important than vaccine implementation. We spend all our time doing that. That's our best hope. I've said that many times now, and we're taking all the steps needed to vaccinate people. Our goal, I should say, is that as soon as the vaccine arrives, that we'll use it really fast. In fact, I think our goal is to say, I don't have any vaccines left, because that means we've used all the vaccines and we're waiting for more. And I think right now we don't have a lot of vaccines, but we're taking steps to be ready for large-scale vaccinations. And I think we had a meeting just a moment ago with our legislators, because I think we'll be ready as soon as whoever makes the decision to give us a lot of vaccine, that we'll be ready to host various county events to vaccinate hundreds of people every day. And that's our hope. So at the moment, we're focusing on the 75 and older, public safety officers, but as soon as we get that, we get more vaccines, we'll do the rest. But again, thank you very much for your recognition. It means a lot to us. We work closely with you. I know Dr. Williams has worked closely with all of you. But again, thank you very much.
Well, thank you. And again, I mentioned it to Dr. Williams earlier, and that when I talk to other superintendents around the state, they're very jealous of this relationship that we have, and they're like, how did that happen? I said, well, I've got Dr. Linderville who initiated that, but we got you two as partners that reached out as well, and we're very fortunate because it's, as you said, it's what's best for our community and our students, and so we're very thankful for that. So I always like to brag about our community, and this is another bragging point, to say what a great community we have, because we have partnerships like this that improve our, just the safety and health of our entire community. So thank you.
Thank you. We feel the same way. We've created this good relationships. It's about working together. We also have a great working relationship with the health department from the very beginning in terms of contact tracing, consultations, and all of that. And now with vaccination, they're helping us today schedule appointments. There are 4 of them. We have the event tomorrow. They're helping us as well. And so we're very fortunate to work together. That's not seen in other counties. I've heard of not such good relationships, but that doesn't happen locally. So thank you very much.
Yeah, well, thank you, Dr. Lunderville. Any other comments?
No, I'd just like to thank Dr. Williams and Dr. Pereira for all of their help. And I've learned more in the last 6 months than I think I did in a number of years of advanced schooling. So thank you.
Thank you to do that. We hope to get more vaccines. I think all of you know that Mariposa was able to purchase the refrigerator needed for the Pfizer vaccine. I think that it seems fair to say that the initial assumption was that most small counties would not be able to do that. That's why we did not get Pfizer, but we reassured them today that we do. So whether we get Moderna or Pfizer, we're ready.
Well, thank you. And if there's anything we can do, we're always open. So if we need to open up our schools to host a site, we're always open for that. I know Dr. Lemro has mentioned that and worked with you as well. So we're ready to help in any way that we can to make sure that we get everybody vaccinated, not only with our district, but in the community. So,
thank you very much. Appreciate that.
Well, thank you again for spending some time with us today. We know how busy you are. So again, this is our Above the Bar, where we highlight members of our community that go above and beyond and do great things. So thank you again for all that you do, and we appreciate your time.